We are live.
All right, good morning. This is Senate Health and Welfare. It is February 9th, and this morning we are taking testimony. It's a full morning of testimony on S37, which we walked through earlier, and it's an act relating to access to legally protected healthcare activity and regulation of healthcare providers. So as I said, it's a full day of testimony, and what I'm going to ask folks is, unless you have a real significant question to understand the testimony, to try and listen and hold questions, and we'll try to get around to some questions, especially for folks who are on Zoom, but we want to be able to hear everything that is being brought in, and we will have written testimony as well. We can always reach out later for additional information. Good morning, everyone on Zoom as well. So we're going to start out this morning with Jessup Barnard, sort of the higher level provider overview. Jessup, why don't you come on up? And people are in the room. This is great. So much still on Zoom. That's great.
Yeah. Thank you so much. Jessup Barnard. I'm the Executive Director of the Vermont Medical Society, and I think this is actually the first time I've testified in this committee this session. So I'll just.
Do you know everyone?
I feel like I know everyone via Zoom.
Well,
I have watched a lot of this committee's testimony.
Let's have everyone introduce themselves, and this will serve folks who are on Zoom as well and people in the room. So let's go around. We'll start with Senator Hardy.
Oh, hi, I'm Liz Hardy. Nice to see you.
Jerry Williams, Senator from Rutland County.
Senator Lyons.
Dave Weeks for Rutland County.
Hi, Jessica Martinez from Burlington. Thank you. Nice to meet you. Thank you. So I'll just tell you a little bit. So the Vermont Medical Society is a statewide physician and physician assistant membership association. We have physicians of all specialties, all practice locations and types. So they may be in private practice, in federally qualified health centers, or hospital-based. And I'm also pleased to be testifying this morning, not just on behalf of our organization, but some of the statewide specialty associations. So the American Academy of Pediatrics, which represents care for children, and the Vermont Academy of Family Physicians, Family Practice Medicine, and the American Academy of, the Vermont Psychiatric Association, so that's psychiatrists providing mental health care. We, as the Vermont Medical Society, serve as the administrative home for a number of these specialty societies. They're their own independent organizations, have their own boards, but we provide some of them administrative services, so it's a great sort of two-way communication. So when they have bills that they want to weigh in on, sometimes we offer sort of collective testimony on the issues. So collectively, the organizations testifying this morning represent around 3,000 physicians and PAs in Vermont. As I mentioned, we provide primary care and specialty healthcare services in a range of hospital and independent and FQHC settings. And our members provide across our organizations the full range of reproductive and gender affirming healthcare services. And I'm really honored actually to be the first witness on this bill. It's such an important bill to our members. We fully support it. We really appreciate you taking it up early in the session and ask that you do move it forward. So we'll start with that and our excitement over the bill. And why do we support it so strongly? We support the findings of not just Vermont organizations, but the leading national medical associations that both comprehensive reproductive healthcare services and gender affirming care are the standard of care in medicine. And I have footnoted a number of those clinical guidelines setting the standards for access to those services. That was a question, as you know, there's sort of a companion bill that is moving up in the House, and that was one of the main questions. Are these evidence-based services? And yes, both reproductive services and gender affirming care are well-established, accepted, and needed medical services. So if you want to take a look at any of those guidelines, please do. And based on that, we also, as an organization here in Vermont, the Vermont Medical Society, have established policy positions supporting access to contraception, abortion, and gender affirming care. You're, I'm sure, well aware, following the news, that such services are under attack in a number of other states. About half of US states already have or are expected to enact abortion bans or other limits to the procedure. And similarly, more than a third of the estimated 150,000 transgender youth in the US live in the 15 states that have already restricted or banned access to what is the best practice medical care for transgender youth. These laws vary widely. It's hard to kind of generalize what they look like, but can carry significant civil and criminal penalties for healthcare professionals who provide such services, including decades of prison time, tens of thousands of dollars of fines, and new forms of civil liability. The civil liability is exemplified by Texas's ban on abortions after 6 weeks, SB 8, which allows any private citizen to sue anyone who performs or induces an abortion or aids and abets in the performance of an abortion. As I just mentioned, H89, which is moving its way through the House and is actually going to be on the House floor tomorrow, addresses ways to reduce healthcare professional civil and criminal liability for those actions, for those providing that type of care, this protected care. However, the risk of professional disciplinary action is undoubtedly higher because of these laws in other states, not what we've done here in Vermont, but the actions of other states. In professional disciplinary cases, any individual can file a licensing complaint, and that triggers the licensing body to investigate. And I know you'll have Lauren Hibbert or OPR here at the Board of Medical Practice. They can talk more about how that process works. But again, anyone can file a complaint, and that triggers an automatic investigation. We have an example. This isn't really a cross-state example, but it is in a way. The Attorney General in Indiana. There's a well-publicized case opening an investigation into a physician who performed an abortion on a minor, even though that procedure was legal at the time in their state, alleging that the physician did not properly file a child abuse complaint, and also kind of a medical privacy aspect of the claim, which really most leading medical associations, I actually think the American Medical Association is going to file, is helping with witnesses and amicus briefs in her case. She was really performing the standard of care, but some of these administrative complaints have been used to really harass and target her. The Florida Board of Medical Practice and Board of Osteopathic Medicine are in the last stages of finalizing rules. In fact, I think there's a hearing coming up in a few days that define providing gender-affirming services as against the standard of care, leading to investigations or discipline in any instances of providing care against their policy, despite this being contrary to national and international best practice guidelines for care. So a state licensing board gets to define the standard of care, even if that's not consistent with generally accepted practices. And so that would potentially put any provider providing those services in Florida at risk of disciplinary action. So given the tactics of laws like SB 8 in Texas and the regulations being considered in Florida, both legal and professional discipline risks now attach to healthcare professionals caring for patients, certainly the professionals located in those states, but also patients who may travel to Vermont to seek care or seek in person in Vermont or via telemedicine. Based on this, in September, our board, the Vermont Medical Society Board, adopted a policy in support of SHIELD laws that would protect Vermont healthcare professionals to provide reproductive or gender-affirming healthcare services. That was around the time we became aware of this. States began contemplating this even pre the striking of Roe. We knew when that decision was leaked that was likely coming. States started having these conversations. How can we protect our providers who are providing care legally in our states, but maybe targeted by other states? And so we were interested in we had conversations with some of you, could we do something in this late spring? And then we realized, no, we really need to learn from what other states are doing. And so in the meantime, Massachusetts, New York, Connecticut, a number of states have adopted laws like this. So while Vermont would be still in the forefront, we can also learn from other states, and a lot of what's in certainly the bill upstairs and some of the provisions here we know are modeled off of other states. And so we support that approach. Of utmost importance to our members are in order to protect access to care, are the provisions regarding continued malpractice coverage. So being able to still have malpractice insurance for providing services. And Vermont's disciplinary boards not taking action based solely on providing what would be defined as legally protected healthcare activities. And also we really support the section looking at the implications of the Interstate Medical Licensing Compact, so the compact for MDs and DOs. We know that national body who oversees that compact is aware of these issues and has passed some new rules to try to avoid some of this cross-state disciplinary repercussions of providing care. But there may be still more areas for progress or ways that Vermont should respond. So we think having a report on that issue is a great step forward. So again, overall, absolutely support all the sections of the bill. We think it makes a lot of important steps in terms of protecting providers, protecting patients, coverage for services. I do have some specific language suggestions that we look forward to removing, going over with the committee. I can go into some of those this morning. They're also listed out in my testimony.
If they're in your testimony, that's helpful. I think if you identify the definitions by name, and then we'll
Come back to the, sure.
So
So I'll-
as we go through the bill markup, we will be looking at all the recommendations made to us from various folks and looking at the testimony. If there's something key there, or I know that the House has made an amendment to the definition, but
yes.
I don't know what will get to us eventually.
Yes, we do. So we were, and your legislative council fortunately was involved in some of those conversations as well. We support the changes upstairs. We did think some of the exceptions to legally protected healthcare activity were not actually really getting at what the intent was. So I think that's really improved upstairs. We do, and I think legislative council has mentioned also perhaps breaking out how the definitions apply to providers versus insurers. I think the way they're combined right now is still a little confusing for interpretation purposes. So we would support, kind of be happy to help with those efforts.
Okay.
So I'll just mention the areas then maybe where our comments are, or
Yeah.
Okay,
Yeah, mention the areas, and then if it sounds like there's something that we want to dive into, I might ask.
then you can ask, sure, perfect. So under the provision about malpractice rates being based on healthcare activities in this state, that may unintentionally exclude telemedicine.
Yes.
So you may just want to look at how that, whether you need that phrase in there at all.
Where is that?
So that's section 2, it's page 6, line 5. It says that malpractice insurers cannot adjust rates based on healthcare activities in this state, and as I read that, that would exclude telemedicine.
And this is all in your
It's
testimony.
in my testimony.
Yeah, so that-
Right, yes,
yeah.
and also. Sections 6 and 7 about unprofessional conduct, what I don't see in there is a statement, and I know this is, given our at least current compositions of our boards, unlikely, but I don't see included that a Vermont board could not take disciplinary action solely based on the actions of a licensing board of another state due to the provision for assistance in legally protected healthcare activity. So it's kind of like if another state has disciplined someone, in some instances that sort of currently automatically triggers an investigation in Vermont, but we may want to say if it's for this purpose, that doesn't automatically trigger a Vermont.
Got it.
Disciplinary action. The section on emergency contraception, this is not a big issue for us. I just wanted to flag it. There's an immunity provision for dispensing emergency contraception. I just wasn't sure. I don't know that that's common in other protocols for prescribing and whether that was needed, but it's not really, that's just a minor issue. Section 14 around data privacy, we support the inclusion of this provision. I think it is in pretty good shape, but we did have some concern. The definitions were a little, also in that section, a little confusing to me. I was reading through it and trying to understand there were sort of multiple exceptions that didn't necessarily look like they entirely lined up with each other. So it seemed like it might be a little, especially for a provider trying to comply with it, a little difficult. Then we also, in that section, think that it might be worth applying those same data protections, not just to covered entities, but to business associates of covered entities. So that would include things like your electronic health records vendor, if you're part of a health information exchange, or other entities that hold your medical information. So I think that would help with some clarity of that section and ensuring that the records were protected as you intended to be protected. And then again, a somewhat minor point, but in a later section around saying a covered entity could use data for the defense of an action, but they could provide it to their attorney or malpractice carrier for their defense. I think that may need to be brought into, generally, if they are defending against a claim, they may need to use that information. So for example, if a patient brings a malpractice action against them, they may not just need to provide those records to their attorney, but actually to the court as evidence in that case. So again,
That part was clearer than the other parts. I thought, but anyway.
Yes, there are some quick, I'm happy to help with those definitions. I think for me in particular, it's kind of the definition of applicability with some of the exceptions. I would be happy to work with the committee or legislative council to try to maybe clarify some of those definitions. But again, big picture, thank you for taking up the bill. We fully support it. We really ask for you to help move it forward. I know some of our members who are physicians will be speaking to you on specific portions of the bill and can also give you more of a kind of clinical perspective on what the bill is doing.
Thank you. This is a great overview, and we do have your testimony.
I
I'm
think
just
you do
not
have my
able-
written
I
testimony. Yeah.
can't get out, I know it's there.
Okay.
I just refreshed and it showed up, so.
Yeah, I've done that twice.
Okay.
So we'll see if we can do that. But thank you.
Thank you.
And any questions, specific questions for clarification? I think as we go through the bill and look at the various testimonies, we'll be able to put this together. Some of it's above our pay grade. We'll look to Ameren for help.
Thank you so much.
Okay, thank you. And we're fortunate to have Dr. Gibson on Zoom. Good morning. It's good to see you again.
Good morning. Good to see you.
And just to say, I'm sorry I missed you last summer. Anyway, so everyone around the tables introduced themselves once, so I'm hoping that you are familiar with who we are. And we would like for you to introduce yourself for the record, and then we'll listen to your testimony. So thank you very much for being here.
Sure, my pleasure. Thank you for having me. So good morning, Chairperson Lyons and Vice Chair Weeks, members of the Senate Health and Welfare Committee. I'm really grateful to all of you for the opportunity to be here today to show my support for S37, an act relating to legally protected healthcare activity and regulation of healthcare providers. My name is Dr. Erica Gibson, and I am a board certified pediatrician and adolescent medicine specialist. I currently serve as the Division Chief of Adolescent Medicine at the University of Vermont Children's Hospital, where we run several adolescent medicine clinics, including the UVM Children's Hospital Transgender Youth Program. Today, I'm speaking not only as a physician who provides care to youth and their families, but also as an official representative of the University of Vermont Health Network, a member of the executive board of the Vermont chapter of the American Academy of Pediatrics, and as a member of the Vermont Medical Society. In April 2021, as attacks on youth gender care began to escalate in both public forums and state legislatures, the Vermont chapter of the American Academy of Pediatrics, UVM Children's Hospital, the Vermont Medical Society, and multiple other Vermont health organizations released a comprehensive memo that addressed the importance of the provision of thoughtful, developmentally appropriate, family-centered, comprehensive gender-affirming healthcare as recommended by evidence-based healthcare guidelines. That memo reiterates the fact that every major medical organization in the United States recognizes the medical necessity of gender care for improving the physical and mental health of gender diverse people. And we've submitted a copy of that memo again, along with this testimony today. Unfortunately, as I speak to you here today, almost 2 years later, numerous other state legislatures have passed or are attempting to pass discriminatory laws that aim to prevent young people and families from accessing appropriate gender care, and also seek to penalize gender healthcare providers for providing this care. To quote a pediatric colleague of mine who testified against one of these bills in Ohio, these bills are an extreme rejection of safe and effective medical treatment for a vulnerable group of youth, and they enact barriers that would cause families irreversible harm and ultimately cost lives. In addition, these discriminatory laws in other states place my pediatric colleagues in the ethical dilemma of refusing evidence-based gender-affirming healthcare or face loss of medical license or criminal charges for providing this care. We're thankful that the state of Vermont has remained steadfast in support of gender diverse youth and their families and the care that we provide to them. I would like to acknowledge the important joint resolution that was passed by the Vermont legislature in June 2022 to support transgender youth and their parents who seek essential medical care for the treatment of gender dysphoria. At this time, in a mounting crisis of child and adolescent mental health care, it is essential that care for gender diverse youth and their families is protected, and that the providers providing this evidence-based care are protected also. This bill will expand the ability to safely care for young people and families that seek evidence-based, legally protected health care in our state. Nothing in this bill recommends changes to established evidence-based care guidelines or current recommendations for consent to care. It is aimed solely at protecting providers, patients, and families from out-of-state interference in care. I've been asked to briefly summarize the definition of gender-affirming care here in my testimony today. In addition to this statement, I respectfully submit a document entitled Supporting and Caring for Transgender Children, which was jointly written by members of the American Academy of Pediatrics, the Human Rights Campaign Foundation, and the American College of Osteopathic Pediatricians. This document eloquently details the approach to gender affirmative care and also addresses the harm that may come from non-gender affirming care. In a gender affirmative care model, pediatric providers offer developmentally appropriate care that is oriented toward understanding and appreciating the youth gender experience. As stated by the American Academy of Pediatrics, this means a strong, non-judgmental partnership with youth and their families that can facilitate exploration of complicated emotions and gender diverse expressions, while allowing questions and concerns to be raised in a supportive environment. Gender affirmative care recommendations, as with all medical interventions offered by healthcare providers, are guided by the scientific evidence and ethical obligation to act in the best interest of patients. As stated by the American Medical Association, a physician must tailor recommendations about specific interventions and timing of those interventions to each patient's unique circumstance, and must be sensitive to the child's clinical situation, short and long-term development. In the case of gender affirming care, no medical interventions are mandated at any time, and no medications are offered to patients and families until puberty has started. Once puberty has begun, families might take the first step of initiating fully reversible medications, and then during later stages of care, might take the step of initiating partially reversible medications. It is important to understand that decisions to begin any medical interventions include a thorough discussion and education between a care team, a young person, and their parents and guardians, or guardians. We thank you for your commitment to the health and well-being of anyone seeking healthcare in Vermont, and on behalf of our patients and families and the multiple professional medical organizations that I represent today, we respectfully ask the Vermont Senate to pass this bill. I'm happy to answer any questions.
So given that your testimony is pretty basic to a good portion of the bill, I'm going to ask committee members if they have questions at this point. I know we did pass the resolution last year, and it was a good resolution, and we appreciate your support for that as well. Questions?
Hi, Dr. Gibson. Thanks for being with us today. This is Ruth Hardy. I just thank you for your testimony. I'm wondering if there's anything in the bill that any changes you suggest, or if you're comfortable with the language in the bill and the definitions in the bill.
Yes, I'm comfortable with the language in the bill and the definitions at this time, but I would defer to my VMS colleagues on a lot of those topics, and they have consulted with me, and I know they will consult with me if there are other questions.
Okay, great. So we'll count on Jessa to be your voice box in the room. Thank you.
Sure.
Senator Weeks has a question.
Good morning, Doctor. Just a basic question on your comment about at the point of puberty that you're supporting a reversible medicine treatments. I'm wondering, I'm curious, because you didn't mention it, what about the irreversible medical processes? I'm just kind of wondering what you and your organization think in that regard.
So again, we follow the patient care guidelines issued by the professional medical organizations that we work with, which include primarily the American Academy of Pediatrics and others. So in later stages of care, there is the option for a young person and family to opt for medications that might have some irreversible effects. And we carefully review those with folks in clinic. There's no prescribed path for people. So we present options and provide education about short-term and long-term side effects. And then we decide together if that's what a young person and family feel is an appropriate next step.
Okay.
Does that answer your question?
It's starting to.
Yeah.
Thank you.
And you have the guidelines in your footnotes of your testimony, so folks can go to that link and then review. I think there's a broader process and description of medical practice there, which is helpful.
Yes, I submitted one document in particular that has some nice charts that summarize some of the more specific aspects of the medical care that's offered in terms that non-medical folks might be able to understand.
That's great. So, yeah. And if we have questions going forward, we may be back in touch through Alex and ask for either some written information or maybe ask for your own Zoom.
No problem. I'm available for anything.
Okay, thank you. Any other questions? It's terrific to have you here today. It's good to see you as always, and thank you so much for the time that you're investing in this and for the work that you're doing. Thank you very much.
Thank you so much to all of you also.
All right.
Thanks, bye.
So we're going to move on. Lucy Rush is here from Planned Parenthood. And Lucy, welcome.
Thank you.
We know the work that you've been doing on this, and your clinics are so critically involved in supporting people with reproductive care. Thank you for being here.
Thank you, Chair Lyons. Good morning, everyone. My name is Lucy LaRish. I'm the Vice President of Vermont Public Affairs at Planned Parenthood Northern New England. I want to express my gratitude to this committee for taking up the bill S37 and for your leadership in doing all that you can to protect patients and healthcare providers and accessing and protecting healthcare in Vermont. PPNNE is the largest reproductive and healthcare and sexuality education provider and advocate in Northern New England with health centers in Vermont, New Hampshire, and Maine. There are 7 Planned Parenthood Northern New England health centers in Vermont, and last year we served 16,000 patients in our state. Our services include abortion care, birth control, cervical, breast, colorectal, and other cancer screenings, erectile dysfunction, treatment, follow-up services for abnormal Pap tests and HPV, initial infertility workup, miscarriage care, trans-inclusive health care, including gender-affirming hormone therapy, STD testing and treatment, and prevention services, as well as well-person checkups and more. Since the Supreme Court overturned Roe v. Wade last June, bans have eliminated access to all or some abortions in 18 states. More states could implement abortion bans this year. The consequences of these bans have been devastating for both patients and providers. And the effects of these bans are not limited to states where abortion is no longer legal. In Vermont, New Hampshire, and Maine, where abortion is protected, we have seen patients traveling long distances to access care. The harmful effects of abortion bans stretch beyond abortion care. It's now harder for people to get life-saving medical treatment for miscarriages, ectopic pregnancies, and other pregnancy-related complications. Providers and medical staff in states with harsh consequences for people who perform or assist in abortions are afraid to treat patients, even in emergency situations. This puts the health and lives of pregnant people at risk, as providers are forced to delay care until urgently needed procedures and patients are dangerously sick. so they can legally provide care that meets the definition of life-saving in their state to ensure compliance with restrictive laws. We also know that anti-abortion rights lawmakers are not stopping at banning abortion. They're working toward a broader agenda to roll back our rights and freedoms, from access to affordable birth control and LGBTQ+ healthcare. We deeply appreciate the inclusion of gender-affirming care in S37. Across the US, there are continued attacks on transgender rights and gender-affirming care. In 2021 alone, state legislatures across the country introduced more than 100 bills to restrict trans care, with close to 60 of these bills amounting to healthcare bans for trans youth. This trend continued into 2022, with more than 150 anti-trans bills introduced, about a third of which would limit or entirely ban minors' access to gender-affirming care. I'm here today to express PPNNE's appreciation and strong support for this bill that aims to broaden and strengthen access to reproductive and gender-affirming care and to protect providers and patients, regardless of the patient's location, from negative repercussions for offering and receiving essential and sometimes life-saving care. We do have some comments and suggestions on a few of the sections to potentially help strengthen the bill. And those are written up in my testimony. If I'm taking up too much time, Madam Chair, I'm happy to let the committee read them, but I will start and feel free to stop me at any time.
I think if you summarize where you have testimony, and you're going to send your testimony along to Alex.
Yeah.
And then we can ask questions. This would be great. I mean, don't need to go into complete detail at this time as we go through markup, and we'll have you
can
connect,
reference.
and we can connect you with our ledge counsel as needed to clarify.
To clarify,
Yeah.
sure.
Good.
So Jessa Barnard from the Vermont Medical Society flagged definitions. I think that there's still more that could be done in the definitions, various definitions throughout the bill, specifically in sections 1, 2, 6, and 7. In section 2, and under medical malpractice, at a high level, I think this section could be further strengthened by including additional provisions under F that would prohibit an insurer from taking adverse action based on revocation or suspension of a license or other disciplinary action from another state.
Right.
And based on their provision of legally protected healthcare in this state. In section 8, crisis pregnancy centers, this section aligns with the Connecticut bill to prohibit deceptive advertising from limited services pregnancy centers. That bill was HB 7070, and that was passed in 2019 in Connecticut. The Alliance Defending Freedom filed a federal lawsuit challenging the law in 2021. The case, called CareNet Pregnancy Center of Southeastern Connecticut versus Tom, was dismissed without prejudice in January 2023. The entity suing the state claimed the case was no longer necessary because the Connecticut Attorney General stated they were not aware of deceptive advertisements in the state, implying that they would not be enforcing the law. We do expect that the suit could be refiled if the Attorney General did attempt to enforce the law in Connecticut. And this section could be challenged in Vermont as well. And while we definitely don't oppose this type of provision, we generally advise that the benefit is relatively low and the risk of litigation is significant. We therefore encourage this committee to focus on alternative approaches to targeting crisis pregnancy centers. Vermonters are generally unaware of crisis pregnancy centers, or CPCs. One possible approach would be to engage the Vermont Attorney General to conduct a public awareness and education campaign. This could be done with a modest appropriation and have a significant positive impact. We're also happy to collaborate to find other possible avenues to address the harm that's caused by crisis pregnancy centers. For example, through the regulatory bodies of the Office of Professional Regulation or Medical Practice Board, and I'm looking at violations of professional misconduct. Under section 9, require institutions of higher learning to establish a gender-affirming healthcare and medication abortion readiness plan to address access to such care on campus. You could consider strengthening the stakeholder engagement process here by requiring that the recommendations for improving access to care shall be developed with relevant stakeholders. You could also strengthen this report by requiring information about the percentage of health plans in the state that do not cover gender affirming care, and have the report include a proposal to close that gap if there is one. Emergency contraception, section 11. The definition of emergency contraception in this section includes EC, available over the counter or by prescription. Because this section is addressing a standing order, which is only required for prescription EC, this section could be updated to reference prescription EC. Further, because individuals and pharmacists will be determining whether the over-the-counter version of the prescription version of EC is appropriate for each patient, you may consider suggesting that pharmacists receive some education about how each form of emergency contraception may differ and what benefits each form of emergency contraception may provide. And vending machines, generally bills requiring emergency contraception to be available by vending machines target college campuses. In the college campus setting, these vending machines increase access to emergency contraception for students who may not have access to off-campus pharmacies or who may have privacy concerns about visiting student health centers. These vending machines also allow students to access emergency contraceptives in a more private setting and on evenings and weekends. So this is a really wonderful provision. Access to gender affirming care and medication abortion on college campuses. We really like that you've included a plan for provision of or referral of gender affirming care, but also recommend that you discuss this with LGBTQ+ coalition partners in the state. They may have more insight into whether or not trans individuals are likely to seek gender affirming care on their college campuses. In section 14, data privacy, this is the prohibition on disclosure of protected health information related to legally protected healthcare activity. There were a couple of other bills. This language is similar to that we saw passed last year. I just want to flag one change that the Planned Parenthood Federation of America has suggested in these bills regarding lawful sharing of medical records. As currently drafted, subsection E could be read to allow disclosures, for example, as allowed under HIPAA. We suggest this language could be amended to limit this exception to lawful sharing of medical records amongst healthcare providers. And this could read, nothing in this section shall be construed to impede the lawful sharing of medical records amongst healthcare providers as permitted by state or federal law. With or without these suggested changes, PPNNE strongly supports the intent of this bill, which expands access and protections to healthcare. Providers and patients in Vermont should be able to continue to navigate a healthcare system without harassment, fear, or deception. Last November, Vermont voters voted overwhelmingly to pass the Reproductive Liberty Amendment, protecting reproductive rights in our state constitution. And every Vermont town gave majority support to the Reproductive Liberty Amendment. Every Vermont town. The amendment protects the rights of every Vermonter, no matter their gender identity, race, where they live, or how much money they have. S37 is a national expression of the values asserted by Vermonters in November about protecting the dignity to live your life and be who you are without government interference. Given the hostile environment nationally, it's critical that our state take every available opportunity to expand and protect access to health care for those in our state or for our neighbors forced to travel away from home to get necessary time-sensitive care. This bill is an important step in ensuring that abortion and gender-affirming care remains available in Vermont. We're proud to live in a state where our elected leaders are eager and determined to ensure that people can safely access abortion and gender-affirming care, and that providers can continue offering this critical care with protections from legal and regulatory harassment. We hope to continue with you to increase access in this legislative session and years beyond. Thank you very much.
Thank you. Terrific. And thank you for the work that you've been doing in this area. Really important to our committee. So, and given the kind of the where you are and the knowledge that you have, folks have questions for Lucy. Lawyer LaRouche. Go ahead, Senator.
I'm just now beginning to realize the incredibly complex process that goes into drafting bills and the language.
Yeah.
And how expansive do you make it? How detailed do you make it? So on and so forth. But with that in mind, I did want to point out one thing when we were talking about section 14, data privacy. In your written testimony, it says we suggest this language should be amended, and when you were speaking, you said could be amended, and I was just wondering, I know that's a subtle difference, but thank you.
I have in my comments here, I said, could read to allow disclosures, for example.
Right, and then later, we suggest this language should be amended to limit this exception to.
Are you talking about her testimony?
Oh,
Yeah.
yeah.
Oh, so do we have your testimony?
He's
Yeah.
now up there.
Yeah.
Oh, I'm gonna have to refresh.
I just sent it in.
So, yeah, so.
Yeah, thanks for flagging that. I guess I would,
Paradox.
I would like, for the record, I would like to just say that could is absolutely fine, and really understanding the strength of the word shall and should in legislative parlance. So happy to amend my testimony to use the word could. Yeah, because I also appreciating, as you pointed out, there's a lot of nuance here, and there are lots of ways to look at language, and I know that Joseph Barnard had also some suggestions about this section, so.
Yeah, well, you know, so we have to put it all together, and as we go through,
Put the puzzle
Amarin
together.
will make our choices good.
Bill markup is super fun. You're gonna love it, Mark.
Any other questions for Lucy?
Can I just generally thank Planned Parenthood for being what I would call just a wonderful organization. And I know you probably don't always get a lot of praise, but I want to give you some publicly right now. Thank you.
I really appreciate that. Thank you, Senator.
Thank you for your work. Thanks for being here.
Um,
So we're good. And we'll look at your testimony, and then as we need clarification, Amarin will reach out.
And I will make myself as available as possible.
That's good. Yeah, I think some committee members may want to chat with you.
Yeah, absolutely.
So, I just want to say that the first part of your testimony is really important because you share with us the breadth of work that you do. In addition to, everybody always is talking about abortion.
Mhm.
And that soon it'll be contraception.
Right.
And it's more than that. And it is so critical for people who are near Planned Parenthood clinics.
Yeah, I will just add, if you don't mind, that for most of our patients, we're like their primary care provider, we're the only care that they get. So, yeah, these are not with their centers.
Okay. So, and we have Polly Crozier here from the GLBTQ folks. Good morning. Welcome. We introduced ourselves earlier, and you were on the screen, so we're hoping that you are connected with us. We're connecting with you. But why don't you introduce yourself for the record, and then we'll hear your testimony.
Absolutely. Thank you so much, Chair Lyons and members of the committee for having me. I have been on the hearing and really benefited from hearing all the folks before me. So thanks for that opportunity. My name is Polly Crozier. I'm the Director of Family Advocacy at GLBTQ Legal Advocates and Defenders. GLAD works in New England and nationally to promote justice on the basis of gender identity and expression, sexual orientation, and HIV status. And we've had the pleasure of collaborating with Vermonters over decades on progress for justice and freedom for LGBTQ people. So that's a little bit about who I am. I am just here to say, you know, I'm so pleased to be testifying in strong support of SB Senate Bill 37. I think through this bill, Vermont rises to the challenge posed by so many challenges. First, an extremist U.S. Supreme Court that has effectively stripped away a long-standing right to abortion and to bodily autonomy, and has also threatened to scale back other foundational rights, including the right to contraception, to equal marriage, and to LGBTQ intimacy. I think your bill signals to Vermonters and truly to the entire country that Vermont is going to use its resources to ensure that individuals and their providers using evidence-based best practice medical care, not the government, are the ones making decisions about healthcare and well-being, to ensure that there remains really robust access to reproductive and transgender healthcare in Vermont, including economically and geographically, and to ensure that patients and providers are protected as much as possible from unfounded efforts to criminalize vital and evidence-based healthcare so they can really thrive in their lives and in their livelihoods. I wanted to share just a little bit about why this is so important, particularly for the LGBTQ and transgender communities. And I think obviously it's probably very well known to this committee and to the Senate as a whole that LGBTQ people, particularly transgender people, are really facing unprecedented attacks across the country. We've already heard this morning that already in this very young legislative season, over 185 bills have been filed across the country attacking transgender people, and not only their right to access to medical care, but for youth to participate in sports with their peers, for youth to use proper names and pronouns in school, among other bills. And it feels often like an all-out assault on transgender people to dehumanize them and strip them of their right to exist and thrive as the beloved community and family members we know them to be. GLAAD has been working very hard on defense in collaboration with many to beat back these kind of efforts in New England, because there have been bills in New Hampshire, Maine, Rhode Island, and Connecticut that are really seeking to restrict the rights of transgender community members. GLAAD has also been collaborating on court challenges on bans to access to transgender medical care. My colleague Jennifer Levi is leading the team in Alabama, which Alabama enacted a law to make it a felony with a possible 10-year prison sentence for a provider, a patient, a family member, a parent, a minister, anyone who helps a young person accessing medically necessary care. Luckily, in that litigation, the law is currently enjoined, so it's not in effect now, but the litigation is ongoing. And as we know, there are many efforts across the country to ban access to transgender healthcare for youth. And unfortunately, Utah just recently enacted a ban on access to transgender healthcare for minors. So this issue is one at which, GLAAD and so many are at the forefront of trying to, make sure that there's access to evidence-based healthcare for minors. I think the Dobbs decision from the U.S. Supreme Court was really a call to action, and I really thank you for answering the call with this bill and with this legislation. And I think particularly for protecting providers from disciplinary action for medically necessary best practice medical care is incredibly important. And I think particularly in the realm of transgender healthcare, which is such interdisciplinary care, there's a whole team of people who are taking care of patients and their families, right? You have doctors, nurses, social workers, PAs, pharmacists. There are so many people who touch and are involved in this care, which is very careful and thoughtful. And it's very important to protect the full scope of those providers. It's also, I think this bill is wonderful to ensure access to insurance coverage for medically necessary care and to kind of better understand the existing holes in access to healthcare in Vermont. I think, transgender healthcare, as you heard from Dr. Gibson, is well-established standard of care medicine that is really necessary to treat the serious but highly treatable condition of gender dysphoria. And so other states' actions to ban and criminalize this healthcare is really having a negative impact on our youth and transgender community members in their day-to-day lives, and is also threatens to drive providers away from the practice. And laws like this are needed to ensure access to care for patients and their families for a condition and for a population that has really been stigmatized and attacked unnecessarily and unfairly. And I think we know that people really thrive when they have access to medically necessary care that they require. And I think the importance of action by states, particularly Vermont in this moment, can't be overstated. In recent weeks, I have heard in our work throughout New England from one provider who has had to move their home to be safe. Another provider who only goes to work, transgender healthcare provider who goes to work in a bulletproof vest. Another provider who works in a major children's hospital in the emergency room, talking about the number of times the whole hospital has been shut down due to bomb threats. I think that extremist actions seeking to restrict access to transgender healthcare are threatening to undermine our entire healthcare system and all our communities. And it is so important to take a thoughtful measure approach to do what Vermont can to protect access to care. And I just want to say thank you so much in this exceptional moment in history for your hard work, for your vision to get this right for Vermonters and for all people seeking access to transgender healthcare.
Thank you. Thank you for your work. Do you have your testimony that you could send into Alex so we have it on the record?
Yes, I will certainly do that and send that to Alex, and appreciated the staff's help in coordinating, and I will do that. Yep.
And do you represent more than Vermont, or do you represent? Yes. So what is the extent of your representation then?
Yeah, so we are a New England-based organization. I mean, we do work nationally on particularly transgender rights issues. We had one of the first transgender rights projects in the whole country, but we are a New England-based organization. So we work throughout the New England states to really make sure that the New England states are, a zone of equality for transgender and LGBTQ people and people living with HIV. But like I said, one of my colleagues in particular, Jennifer Levi, is really a leader on transgender rights across the country. So she's involved in litigation in Alabama and in supporting folks, as Jessa Barnard noted, in Florida, and doing what we can to ensure that there's access to transgender medical care no matter where it's needed. But yes, we are a New England-based organization and have worked, I think, very closely with Vermonters over the course of the decades on various issues. I myself worked with folks on the Vermont Parentage Act in 2018, and just appreciate always the thoughtful approach that Vermont takes to making policy decisions.
Okay, thank you. Any questions? I think we're good. Okay, terrific. Thank you very much for being with us this morning, and good luck.
Thank you so much.
Work to do.
We do too.
So do we. Oh, don't remind us. Oh, have we gotten to the break?
We have.
And we're early. Is there any, do we know if we've had an addition to this or not?
I think that is what we.
That's what we have today? Okay, because I'd reached out to another person to speak this morning, but was not available. Wow. We're known for doing things quickly. Amber, do you want to make any comments about where the House bill is at this point? That might be helpful if you come up and share with us just where it is and what the House Judiciary Bill, and then we're going to take a break. Just what the House Judiciary Bill has in it, any changes that they've made to definitions. You don't have to go through what they are specifically, but just give us that update and then we'll take a little break.
Certainly, for the record, Amber Naber, Daily Legislative Counsel. So yesterday morning, the House Judiciary Committee voted on H89. They have voted to amend the bill as introduced. So if you go to House Judiciary's webpage, you'll be able to click on the House Judiciary Committee report, and that is what will be going to the floor on Thursday, tomorrow. There are some changes to the first section, which is the definition section, that we had identical definitions in H89 and in this bill S37, which you may recall. So House Judiciary Committee has voted to amend those definitions in H89, and that will be voted on tomorrow. So that includes, I believe the primary changes were to the definition of legally protected healthcare activity. So that would be a good thing to take a look at, noting, however, that it has not gotten through the House floor yet, so it's still subject to change.
Yeah.
And there are other changes throughout the bill, but I think in terms of what impacts S37 most, it is that first section.
Questions, go ahead.
Just trying to follow the track of H89. So it's voted out of judiciary at this point? Or
It has been voted out of judiciary, yes.
how did that go?
So now it's on notice today, is that right?
Yes.
And then tomorrow it will be up for second reading. So it'll be a presentation on the floor.
Right.
And then questions.
And then third reading on Friday. And then if it passes, then it will be passed.
Tuesday, we'll probably get it, if it passes.
I'm sure it's public knowledge, but what was the vote in the Judiciary Committee?
I am not certain.
I know,
I'm just curious.
9-1.
Is that a companion bill?
Companion bills usually refer to identical language. I would say these are related bills.
Your sister.
They're related. One is that's part of the legal lawsuit concept, and the other one is protected healthcare providers and legally protected healthcare services. That's us.
Can I ask a question? Okay, I'm not sure if you know this, or if this is really a Michelle question, because she's staffed that bill, not you,
Yes.
right? Yeah. It's a question about extradition. Should I ask her?
Yes.
Okay.
Yeah, that's a Michelle question. Big time.
This is more a process question.
Sure.
For the freshmen,
No, that's
for the
good.
freshmen in the group.
Terrific.
Two bills nearly identical come, they pass at,
They're not identical.
well, okay.
Yeah, but the definitions for protected healthcare activity is identical. So if someone's gonna sue you and take you to court for violating protected healthcare activity, I just let you answer this question.
In terms of the differences between the bills.
Yeah.
I guess so,
Yeah,
at
that's it.
40,000 foot level, yeah.
Yeah.
Certainly. So there are a fair amount of judiciary issues, such as once a lawsuit has begun, there are subpoenas. And so we get into issues of extradition, subpoena power, recognizing other states' authority to submit subpoenas or to request to extradite someone, abusive litigation scenarios. So these are topics that usually get referred to the judiciary committees rather than the healthcare committees. And similarly, the topics that are in S37 that are around professional licensure and regulation of healthcare professionals, what types of services are covered by insurance, fall into healthcare committee jurisdiction. So rather than trying to have all of these topics in one bill that then has to move between two big committees with heavy policy decisions to make, it's divided so that judiciary can proceed with all those judiciary issues. These bills are unique in that they have an identical section. They would both add Title I, Section 150. Right. So, and the reason to have that identical provision in both bills is that it's integral to the issues that fall in each of those bills. Having an understanding of what are we defining legally protected healthcare as affects every other provision in the bill. So that's why it's in both bills. And there's the understanding sort of from the beginning that we will need to at some point reconcile both bills for the definitions aspect.
Okay, thank you. So,
But then we'll see a definition on abusive litigation in our bill that was probably more pertinent to the judiciary bill. So we'll see where that goes. Yeah, and you answered it a lot better than I would have. So I appreciate that.
So procedural questions. So it has the second reading.
Yes.
At what point does it come to the Senate?
Tuesday.
Yes, so if it passes second reading, and then if it passes third reading on Friday, then it will be referred over to the Senate, likely to Senate Judiciary. I'm guessing, just as this bill will be, if it passes through this committee and then the floor, it will be referred over to the House, probably to the House Healthcare Committee.
And before we finish our work on this, obviously judiciary will look over what we've done. And then there's going to have to be coordination between here and House. So it's not complicated, but it's communication.
So there's a possibility that when it finally comes to the Senate, it could go back for the members.
Right, it can, I mean, we were talking about if the healthcare committee acts on it and they do something different, then there may be a conference committee, and there might be a conference committee on the judiciary section, so there's gonna be a lot of coordination going on. Hallelujah. Yeah, a lot of fun.
Last procedure
No, this
question,
is fine.
conference committees, who and how are they formed? Again, just because I've never seen it.
So conference committees were a long way away, hopefully.
I'm just,
But what happens is that usually the chair of the committee that passes the bills out makes a recommendation about who's on the conference committee. If it's an issue that requires insight from more than one committee, sometimes you have members from more than one committee. So, we can talk about that. Okay, thank you. Yeah. Oh. Okay, any other questions for Amory? So we are now on break. We have 10 extra minutes for break because we're such a efficient